Hello everyone and welcome. I'm your host for today's webinar, Jessica Tu from ProBio Marketing Department. On behalf of ProBio, I'd like to extend my sincere appreciation for your participation in today's webinar. ProBio is a global leader in enabling biotech and pharmaceutical companies to advance the development and manufacturing of next-generation biologics and advanced therapies. As a fully integrated end-to-end contract development and manufacturing organization, ProBio supports its partners in optimizing drug development, accelerating time to market, and provides comprehensive lifecycle support. Today's webinar, we will feature two presentations. Each presentation will include a 30-minute talk and followed by a 15-minute Q&A session. You are encouraged to submit your questions at any time during the webinar using the chat or Q&A panel located in the menu on the right. Now, I'm delighted to introduce today's speaker, Dr. Derek Chen, the Senior Director of Antibody Drug Discovery Department from ProBio. After obtaining his doctorate in immunology from the University of Massachusetts School of Medicine, he joined GenScript in 2015 and has been responsible for antibody drug discovery platform for the past 9 years. He has more than 200 projects experience in antibody drug discovery and engineering innovation optimization, as well as 3 patents related to biopharmaceutical discovery. During today's webinar, Dr. Chen will be firstly discussing the solutions of functional leads discovery via integrated antibody generation platform. Now, I'm glad to hand it over to Dr. Chen.
During the early stage of antibody discovery. Functional screening is the most crucial step for the early stage therapeutic antibody discoveries. It is the key evidence to demonstrate the feasibilities and the necessities for further preclinical development of the candidates. Currently, most of the antibody lead discovery strategy starts with screening for binder, which are candidates specifically recognize the target antigen. Purified antibodies from these binders are further produced for functional characterizations. This process provides a comprehensive screening funnels to narrow down the whole candidate list through a step-by-step fashions. However, functional clones, which is the desirable leads as drug candidates, only takes a very small fraction among these common binders. This kind of workflow not only takes quite some time, but also leads to huge waste of resources spent on those non-functional binders. Taking hybridoma as an example, the process of subcloning, sequencing, and antibody recombinant productions takes up about 30 to 40% of the overall project budget and half of the timeline. In the meantime, diversity is compromised during this extended screening stage. Identification of functional candidates before subcloning will significantly reduce the turnaround time and the overall cost, as well as preventing the diversity loss. So in this, let me re-share the screen. So in this talk, we will elaborate on the subject from the perspective of three different discovery platforms: the hybridomas, the single B cell screening platforms, and the fidget display library. Let's start with the hybridomas. The core concepts of conventional hybridoma technology, as shown in the right panel, is to culture the cells initially in polyclonal condition to maximally promote the survival of the newly fused hybridoma cells, followed by repeated subcloning step to recover the stabilized monoclones. This strategy achieves a compromise between preservation of candidates and extension of the window for the screenings. Basically, it gives you enough time to screen for the candidates while maintaining the hybridoma cell lines. However, this process leads to several limitations. First of all, the polyclonal hybridoma culture, this culture, majority of the cells negative clones, which do not secrete any antigen-specific antibodies. This leads to extremely low concentration of the antigen-specific IgG in the supernatant, making it unfeasible to run cell-based function assay at this stage. Alternatively, if you choose to extend the culture period to enrich the IgG in the supernatant, the longer you culture the cells, the greater chance that these negative cells will outgrow those positive ones, leading to the loss of candidates. And moreover, the subcloning process takes about 6 to 8 weeks, and more hybridoma clones will fail to survive during this stage due to the intrinsic instability nature of the hybridoma cells. To resolve these issues, we developed the PowerDoma platforms, as shown in the left panel, as a upgraded version of a traditional hybridoma. Instead of the polyclonal before monoclonal strategies, the fused cell will be placed into 384 well plates as a monoclones. With optimized culture protocol and a medium and a supplement, newly fused hybridoma cells can survive at extremely low densities and can be cultured with extended period of time to enrich for higher concentration of antigen-specific IgG to facilitate various binding and cell-based function assays. This strategy not only enables the identification of functional candidates at a much earlier stage, but also eliminates the whole subcloning process, resulting in a shortened timeline by 1.5 months, preventing further loss of diversity during the subcloning stage. Comparing to conventional hybridoma, PowerDoma generates roughly 40% of more clones, as shown in this panel, creating a larger pool for screening process. Moreover, we observe a 4-fold higher positive hit rate as a 2,000 versus 500 in average from 11 projects as shown in this panel. In addition, without the subcloning process, the average timeline from fusion to recovered sequence is shortened from 58 days to 30 days. Based on the more than 40 delivered projects over the last year, we can recover the sequence from 97% of the selected positive clones, and 80% of those selected positive clones are monoclones as determined by sequencing results. 100% of these unique sequences can be confirmed as real functional binders after recombinant antibody verification. The choice of function assay highly depends on the target and the drug MOAs. Typically, we can use the PowerDoma supernatant to run high-throughput function assays, including the ELISA-based KD affinity rankings, the internalizations for ADC candidates, reporting assays-based signaling blockade assays. I will share several case studies in the next couple of slides. First of all, the affinity rankings. Affinity ranking is a common practice to evaluate the antibody-antigen binding kinetics. However, conducting this kind of assays using either BioCore or Octet can be very expensive, especially when it comes to hundreds of samples. ELISA, on the contrary, is a much cheaper way to assess the relative affinities, but it lacks the kinetics information. Moreover, single-dose supernatant-based ELISA readout, the OD450, is determined by both the antibody affinity and the antibody concentrations. As a result, people cannot jump to conclusion of affinity ranking simply based on the ELISA OD450 readout. So under such circumstances, KD ELISA is developed as a cost-effective way to gain insights into the affinity ranking data by running single-dose supernatant-based ELISA screening. So the KD ELISA utilize a anti-mouse IgG secondary antibodies to capture the drug candidate antibody in the supernatant, followed by detection with the biotinylated antigen recombinant proteins. The concentration of an anti-mouse IgG is set to a relatively lower level to make sure that roughly the same amount of hybridoma-derived antibodies across the testing samples are captured, regardless the IgG concentrations. So based on the ELISA OD450 readouts of these systems, the candidates with relatively high affinities and low affinities are identified as in green versus in red boxes. So these selected candidates were further purified and characterized by ELISA EC50 dose response analysis. Those high binders, the clone 4, 7, 13, and 15, showed similar affinity range as the benchmark BMK1 and BMK2, these purple curves. While the low binders, the clone 1, 3, and 14, demonstrated a significantly lower EC50 curves comparing to this purple benchmark. Reporter gene assay, or what we call RGA, is a widely used in therapeutic antibody discoveries as a powerful weapons to identify candidates with desirable biological functions. Comparing to primary cell-based assays, RGA comes with a much better signal window and lower background noise. And in this case study, the TIGIT reporter gene assay was conducted with the PowerDoma supernatant on the top. 4 functional positive candidates, the clone 3, 7, 15, and 19 as highlighted in green boxes, and the one non-functional candidates, the clone 10 in the red boxes, were selected for further functional confirmation using purified antibodies. All of these candidates showed normal dose-dependent antigen binding pattern in the flow cytometry analysis. But only those supposed functional positive candidates demonstrated decent signal blockade similar to the benchmark, the clone 22. While the supposed non-functional binders, the clone 10, gave us a minimal signal blockade in these panels. Next, the CEMP assay is another well-recognized approach to evaluate the agonist or antagonist activity of antibody against the GPCR target. In this case studies, several antagonist antibodies were identified by the CEMP assays using the ProBio supernatant in these top panels. The green and the red bar represents 0.2 microgram per milliliter and 1 microgram per milliliter of the positive control, the benchmark antibodies, as a reference. Though for those showed significant neutralization level lower than the red bar were selected for further confirmation of the neutralization activities with purified antibody in dose response curve in the lower panel. The data suggested that these selection of candidates based on the single dose supernatant neutralization assay is in line with the results from the purified antibodies. Next, let's move on to the single B-cell screening platforms. Comparing to hybridoma, single B-cell based technology takes a more direct approach to apply antibody screening on the B-cell level. However, without the immortalized cell line like hybridoma, it has to be done within the very short period of time. You have to finish the whole screening process in a very limited windows. Otherwise, the B cell will start to die. This strategy leads to a couple of restrictions that negatively impact the efficiency and accuracy of the early stage, larger scale screening. First of all, due to the extremely low cell densities, antibody concentration in the supernatant tends to be very low and fluctuates substantially. This limitation leads to the narrow signal windows and a significant amount of false positive and false negative candidates during the screening process. Moreover, the concentration issue and the hardware restrictions further cause difficulties in running cell-based functional assays at the B-cell levels. In addition, a single B-cell based strategy can only run one or two or even three tops round of screenings in parallel or in sequential within a very limited windows before the B cell starts apoptosis. While drug discovery usually requires multi-dimension assays, including binding with human, rodent, monkey proteins, cancer cell lines, and family proteins with high homologies. Candidate selection solely based on one dimension will most likely end up with hundreds, even thousands of positive B cells. It requires a lot extra resources to further narrow down the candidates list if you just rely on your selection based on the one-dimension data. To tackle with these limitations, we developed the ProSpeed platforms, which is built on the concept of a linear expression cassette. To confirm the binding and the function of antibody sequence derived from recovered positive B cells, the conventional workflow on this panel relies on the costly and the time-consuming sequencing, gene synthesis, plasmid preparation, followed by transient transfection and antibody purifications. In contrast, in the ProSpeed workflow on this panel, the DNA fragments of the variable region from an antibody heavy chain and the light chain is amplified by PCR and cloned into the linear expression cassette, which already contain the antibody constructs, constant region, and all necessary expression modules. So basically, without the plasmid, without the gene synthesis and the plasmid preparation, the reaction mixture is directly used for transient transfections. The antibody expression is usually conducted in 96 deep well plates in a high throughput fashion. And the typical range of IgG concentration in the supernatant is about 10 to 100 microgram per milliliter, which is more than enough for binding confirmation and cell-based functional characterization without any purifications. The removal of the laborious single B-cell sequencing and gene synthesis from the workflow greatly reduced the turnaround time from 5 to 6 weeks to 2 to 3 weeks, with a substantial reduction of cost as well. So similar to the hybridoma, powerdoma platforms, the single B-cell ProSpeed system supernatant can also be applied in the reproducing assay, the RGA. In this case study, the identification of an IL-8 antagonist antibody, we recovered 116 binders from the single B-cell screenings, and they are both cross-reactive to human and cyno IL-8 recombinant protein. So these positive B cells were proceed to the ProSpeed expression, the linear expression, and the supernatant from the ProSpeed expression were first tested by ELISA against human and the cyno IL-8 for confirmation, confirming that 85 of them were actual dual binders, among which 16 candidates showed to able to block the IL-8 signaling by reproducing assays. So in general, the overall cost of the whole process is less than half of the traditional approach, which is more like a 40,000 US dollars comparing to 90,000 or somewhere around that. All right, for the last part, let's quickly go over the functional lead discovery in the phage library platforms. So unlike hybridoma and the single B-cell screening approach, phage library relies on the E. coli system, the prokaryotic system, to display the antibodies. So as a result, the phage supernatant demonstrated limited assay sensitivities due to low antibody concentration and the dirty background. Moreover, massive amount of endotoxin released by the E. coli systems often triggers non-specific activation of the immune signaling pathway, leading to the further challenges to identify the real functional candidates with cell-based assays. The endotoxin will mess up the whole readout. As a result, people usually only consider ELISA or FACS screening assays during the phage supernatant stage and conduct the functional screening only after obtaining the recombinant purified antibodies. However, we still managed to develop a panel of function assays uh, in the phage systems to facilitate the candidate selection process during the early screening stage. The first function assay is for the ADC. So for the ADC candidates, internalization is a key features of antibody to travel the toxin into the cancer cell. In order to improve the success rate of identifying antibody with internalization capabilities, the panning process is designed to enrich for antibodies with such features. The initial binding and the wash between phage and the antigen cell is conducted at 4 degrees to prevent the internalizations. Then the enriched mixture is transferred to 37 degree to initiate or to stimulate the endocytosis of phage, the internalization of the phage into the host cells by the antibody, but only for a very short period of time to avoid the degradation of a phage by the lysosome in the cell. After the wash of the surface bind phage, the internalized phage is recovered from the cell lysate. And this cycle of a panning can be repeated for several times to improve the enrichment levels, the enrichment efficiency. So with such protocol, we are able to obtain a panel of Nectin-4 antibodies with decent internalization efficacies as comparing to the benchmark. Therapeutic antibody affinity is highly related to its desirable efficacies in vivos. So for certain indications such as autoimmune diseases, requires a picomolar range of affinity to block the cytokine signaling pathways. So in order to enrich for antibodies with higher affinity range, competitive pannings can be applied. The biotinylated antigen is incubated with phage under excessive amounts of non-biotinylated antigens. The biotinylated antigen will compete against the non-biotinylated antigen for higher affinity antibodies, which is retained for another cycle of a panning for enrichment. By applying higher ratio between the non-biotinylated, the free versus the biotinylated, the capture version of antigen, the affinity distribution profile of the final leads is in favor of the high affinity. So basically, if you put more non-biotinylated antigen to compete with the very few biotinylated antigens, after the repeated pannings, the final output profile of your lead candidates will tend to have a relatively higher affinity range comparing to the 1-to-1 ratio approach. Next, the pH-selective antibody is one of the most well-established conditional activated antibodies. So once bound to the cell surface antigens, the circulating antibody in complex with the target antigen will be internalized for degradation through the lysosome endosome. The release of the antibody from binding to the target will reduce the chance of the degradation. The released antibody will be recycled back to the circulation system through the FcRn, the Fc receptor binding, resulting in a longer half-life. So given the acidic condition in the endosome, lysosome, antibody with a decreasing affinity towards antigen and higher affinity against the FcRn under acidic pH environment is preferred so as to extend the half-life. So in order to obtain antibodies with the pH selective binding features, the panning process is conducted under different pH conditions. The initial binding and the wash are carried out under acidic pH, while the elution is done at neutral pH. The dissociated phage is preserved for another round of a pH selective panning process. By applying such kind of strategies, a panel of antibody were identified and characterized for pH selective binding patterns at the lower panels. Comparing to the reference samples, the bactoclimab, the leads 1, 2, and 3 showed normal affinity at pH 6.0, the hard line, and the minimal binding capabilities at pH 7.4, the dotted lines. For the last part, the epitope is the most crucial factor for therapeutic antibody functionalities. The binding localization on the antigens will largely determine the biological efficacies. So in order to compete with the competitive pipelines targeting the same drug target, people commonly select antibodies with different epitopes on purpose. It may bring either novel MOAs to achieve better efficacies, or at least creates a possibilities to develop a combination therapies with biparatopic features. So in order to steer the direction of antibody enrichment towards desired epitope, masking antibody is co-incubated with phage in the competitive panning process. For those bind to the same antibodies will be retained in suspension, while those bind to alternative epitopes will be captured by the antigens. Though these two fractions can easily be separated via the streptavidin conjugated magnetic beads coupled with the biotinylated antigens. So in the case study of IL-4 receptor alpha neutralizing antibodies, both the regular panning and the epitope panning are applied as comparisons. So the regular panning generates a wide range of candidates, but none of them show significant blockade against the IL-4 receptor alpha and IL-4 interactions. Alternatively, the epitope panning leads to much narrow diversities, but the most dominant one gives a relatively stronger blocking capabilities. The top candidate is further analyzed by dose-dependent competitive assay against the IL-4 in the flow cytometry assays. along with the clinical benchmark, both of which showed robust inhibition of IL-4 receptor and IL-4 interaction. Okay, so that's all for the first talk. Let's move on to the Q&A sessions.
Okay, thank you for Dr. Chen's excellent presentation. We now come to the Q&A session. Please type your questions in the chat or Q&A panel. Additionally, we also warmly invite you to follow our LinkedIn account, ProBio, and Korean attendees can also scan the QR code on the screen to follow our Kakao channel, where we will regularly share our online resources and updates. Okay, we received some questions. Here, thank you for the lecture. Can B-cell sequencing be performed on mouse B-cells? Dr. Chen, could you answer this question?
Sure. Technically, yes. For instance, when we using either the beacon from the Berkeley Lights or the traditional flow cytometry-based sorting technologies, the positive B cells from a mouse or from any other regular animals like rats, rabbits, or even humans can be directly for sequencing. But it takes quite some time, especially when you have like a lot of positive B cells.
Okay, thank you for your answer. And here is a second question is, how are you able to culture the hybridoma as monoclonal right after fusion? Generally speaking, hybridoma cannot survive under such extreme low density because it is very fragile after fusion.
Yeah, that's true. So the traditionally viewpoint, the hybridoma is too fragile to be cultured as monoclones right after the fusions. Majority of them will die if you do that. But nowadays with optimized culture media and culture protocol and also the supplements, we are actually able to the culture the hybridoma cells right after fusions at extremely low cell densities. Of course, some of them will die, roughly 20%, 25% of the wells, there will be no surviving hybridomas. But for the other 75 or 80% of the 384 well plates, you will be able to see visible clones. Majority of them will be monoclones, and some of them will be still be polyclones.
Great, thank you. And the next question is, how effective is the linear expression concept in terms of antibody expression? And what about the antibody concentration in the supernatant?
Yes, I didn't include a comparison data between the linear expression cassette versus the traditional plasmid expression systems. We compared roughly 50 clones in terms of the expression level and the ELISA screening data between the linear expression approach versus the plasmid expression approach. Out of these 50 clones, only one of them show discrepancies, and the other 49 is perfectly aligned between the linear expression approach versus the plasmid-based expression approach. And as I mentioned during the presentation, the typical IgG concentration range in the supernatant is about 10 to 100 microgram per milliliter. If you do the recombinant expression in the plasmid-based recombinant expression, the concentration is definitely much higher. Usually it's around 100 to 500 microgram per milliliters. But 10 to 100 microgram per milliliter is more than enough for supernatant-based binding and cell-based assays.
Very clear, thank you. And the following question is, what is the recommended solution for identification of pH-selective antibody?
Well, yes, as I mentioned in the presentation, nowadays there are three major types of antibody discoveries: the hybridomas, the single B cell, the phage libraries. Each one of them has their own features and their own bottlenecks. Particularly for pH selective antibodies, we actually prefer the phage library because you can manipulate the panning process, like introduced in the last part of the talk. You can set up a panning process with a different pH to enrich for antibodies that shows particular binding profiles under particular pH conditions. So this is a much more efficient process done in phage comparing to what you normally do with hybridoma or single B cell, which are we call the blind screening.
Okay, yeah. Thank you. And I see that's all the questions by now. And thank you all for your engagement and insightful questions. And now let's move